Hi, this is the demonstration of the FUT Linear Scar, and I perform both the FUE and FUT. I try to give as much example as I can of the FUE and FUT scar. And if you look online of my YouTube channel, you can, under the category for FUT scar or under category FUE scar, you can see the difference. So then it will help you decide which technique to choose. Again, I perform both FUE and FUT. Both FUE and FUT produce scar, but they have different form of scar. The FUE has tiny dots of scar, allow you to shave your head shorter, not much detectability. But the FUE does produce scar, where the FUT or the linear scar, this is the demonstration. Again, the result can vary from one individual to another. Some can be larger, wider, or some can be even better than this and barely noticeable. So the pro of the FUT are cheaper than the FUE, almost 50%. We can move 5,000–6,000 grafts per day, and to cover, for advanced hair loss, to reach a goal faster. And then the growth rate is 5–10% better than the FUE. The downside of the FUT are linear scar, and it'll be visible if you shave your head, but you leave it long, no one can see it. The other downside of the FUT is because we cut you open and suture you up, so that means it's a little bit more invasive than FUE, and have more pain during recovery, more chance of infection. Again, I perform both FUE and FUT. The other FUE, there's pro and con. The pro of the FUE is we don't cut you open, so we shave and we plug one at a time. That means less invasive, less bleeding, less chance of infection. We have tiny dots of scar, FUE, and the scar is hard to see when you shave it and allow you to wear your hair shorter. But the downside of the FUE it's more expensive. The number of grafts we can do is less. FUE 2,500 to 3,000 grafts, and most recommend for mild to moderate hair loss, although you can do advanced hair loss. The other downside of the FUE is the growth rate. Now, both FUE and FUT have excellent growth rate. It can be done, and you notice that on my video, but they both have good growth. However, the FUE, if you compare, is 5–10% less than the FUT. So this is the demonstration of the FUT linear scar. I perform both the FUE and FUT. I'm a specialist for both, but the FUT linear scar result can vary from one individual to another. This is one of my many examples, and I try to give as much example as I can. Thank you.